Welcome to our in-depth exploration of ANCA-associated vasculitis, a complex autoimmune disorder that can significantly impact the urinary system, among other organs. This video will guide you through the causes, effects, diagnosis, and management of this condition. Join us as we unravel the mysteries of ANCA-associated vasculitis and learn about the latest advancements in its treatment. The exact cause of ANCA-associated vasculitis remains unclear, but it is believed to be a combination of genetic predisposition and environmental triggers. These triggers, which can include infections like Staphylococcus aureus or exposure to certain substances, may activate the immune system in susceptible individuals. This activation leads to the production of anti-neutrophil cytoplasmic antibodies, or ANCAs, which play a central role in the disease's development. While we don't fully understand why some people develop ANCA-associated vasculitis and others don't, research continues to shed light on potential risk factors. Let's delve into the pathophysiology of ANCA-associated vasculitis. The hallmark of this disease is the presence of ANCAs in the bloodstream. These antibodies mistakenly target neutrophils, a type of white blood cell that plays a crucial role in fighting infection. When ANCAs bind to neutrophils, they activate these cells, causing them to release inflammatory substances and migrate to the walls of small blood vessels. This leads to inflammation and damage to the vessel walls, a process known as vasculitis. In the kidneys, this vasculitis can damage the glomeruli, the filtering units of the kidneys, leading to glomerulonephritis and potentially kidney failure. The inflammation can also affect other organs throughout the body, leading to a wide range of symptoms. ANCA-associated vasculitis is considered a rare disease, but its true prevalence is difficult to determine due to variations in diagnostic criteria and reporting. Studies suggest that the incidence of ANCA-associated vasculitis ranges from approximately 13 to 20 cases per million people per year. The disease can affect individuals of all ages, but is most commonly diagnosed in adults between the ages of 45 and 65. While it affects all ethnicities, some suggest a slightly higher prevalence in Caucasians compared to other populations. The signs and symptoms of ANCA-associated vasculitis can be diverse and vary depending on the organs affected. Common symptoms include fatigue, fever, weight loss, muscle or joint pain. Kidney involvement often manifests as blood in the urine, protein in the urine, and swelling in the legs and ankles. Respiratory symptoms such as cough, shortness of breath, and chest pain may indicate lung involvement. Skin rashes, nerve damage causing numbness or weakness, and sinus or nasal problems are also frequently seen. Because the symptoms can be non-specific and mimic other conditions, early diagnosis can be challenging. Diagnosing ANCA-associated typically involves a combination of clinical evaluation, laboratory tests, and imaging studies. Blood tests are crucial for detecting the presence of ANCAs, specifically anti-proteinase 3-EPR3 ANCA anti-myeloperoxidase MPO-ANCA. Urinalysis is performed to look for blood and protein in the urine, indicating kidney involvement. Imaging studies, such as chest X-rays or CT scans, can help assess the extent of lung involvement. A kidney biopsy, where a small sample of kidney tissue is examined under a microscope, is often necessary to confirm the diagnosis of glomerulonephritis and assess the severity of kidney damage. The diagnosis is usually made based on a combination of these findings. ANCA-associated vasculitis encompasses several subtypes, including granulomatosis with polyangiitis or GPA, microscopic polyangiitis or MPA, and eosinophil with granulomeningitis or EGPA. GPA is characterized by inflammation in the blood vessels in the nose, sinuses, lungs, and kidneys. MPA primarily affects the small blood vessels in the kidneys and lungs. EGPA, also known as Churg-Strauss syndrome, is associated with asthma, high levels of eosinophils, and inflammation of the blood vessels. While these subtypes share some common features, they also have distinct clinical and pathological characteristics, which can influence treatment strategies. The primary goal of treatment for ANCA-associated vasculitis is to induce remission, meaning to stop the inflammation and prevent further organ damage. This typically involves a combination of immunosuppressive medications, such as corticosteroids and cyclophosphamide or rituximab. Corticosteroids help to quickly reduce inflammation, while cyclophosphamide and rituximab are used to suppress the immune system and prevent further attacks on the blood vessels. Once remission is achieved, maintenance therapy with medications like azathioprine or methotrexate is often used to prevent relapses. In cases of severe kidney involvement, dialysis or kidney transplantation may be necessary. Regular monitoring for side effects of medications and disease activity is essential for optimal management. Currently, there is no known way to definitively prevent ANCA-associated vasculitis. However, individuals can focus on maintaining a healthy lifestyle to support their immune system. This includes getting regular exercise, eating a balanced diet, managing stress, and avoiding smoking. In some cases, avoiding potential environmental triggers, such as exposure to certain chemicals or infections, may be helpful, but more research is needed to confirm these associations. Since early diagnosis and treatment are crucial for preventing organ damage, it's important to be aware of the symptoms of ANCA-associated vasculitis and seek medical attention promptly if you experience them. The prognosis for individuals with ANCA-associated vasculitis has improved significantly over the past few decades with advancements in diagnosis and treatment. With prompt and appropriate therapy, many patients can achieve remission and maintain good kidney function. However, relapses can occur, and some patients may develop chronic kidney disease or other complications. Recent research has focused on developing more targeted therapies with fewer side effects. Studies are exploring the role of novel immunosuppressive agents and biomarkers to predict disease activity and tailor treatment strategies. Researchers are also investigating the genetic and environmental factors that contribute to the development of ANCA-associated vasculitis, with the ultimate goal of developing preventive measures and personalized treatment approaches.